Hello everyone, welcome back to Your Thoughts Are Valid, and I hope you all are doing great. So, the topic for today's video is ethical issues in counseling. We will learn about, like what ethics are, and in counseling, what are the major ethical issues therapists, or we can say mental health workers should keep in mind. The basic purpose of psychotherapy and counseling is to help the client with psychological problems. To do this effectively, therapists must behave in an ethical and legal way. Professional organizations for mental health practitioners such as psychiatrists, psychologists, social worker, mental health counselors, pastoral counselors, and psychiatric nurses have all developed codes of ethics that prescribe appropriate behavior for therapists. These ethical codes are in substantial agreement as to actions that constitute ethical and unethical behavior on the part of the therapist. Ethics mean more moral principles that control or influence a person's behavior, a philosophical discipline that is concerned with human conduct and moral decision making. Ethics codes provide a common set of principles and standards upon which counselors build their professional and scientific work. Counselors, like all professionals, have ethical responsibilities and obligations. The principal rule supporting ethical obligations is that the counselor must act with full recognition of the importance of clients' rights, the ethics of the profession. तो जो बेसिक पर्पस होता है साइकोथेरेपी या फिर काउंसलिंग का वो ये होता है कि क्लाइंट को साइकोलॉजिकल प्रॉब्लम्स के साथ हेल्प की जाए एंड ये इफेक्टिवली करने के लिए थेरेपिस्ट को एक एथिकल और लीगल वे में एक्ट करना होता है। प्रोफेशनल ऑर्गेनाइजेशंस जो होती है मेंटल हेल्थ प्रैक्टिशनर्स के लिए जैसे कि साइकियाट्रिस्ट, साइकोलॉजिस्ट, सोशल वर्कर, साइकियाट्रिक नर्स एक्सेट्रा, इन सब के लिए एक कोड ऑफ एथिक्स डेवलप्ड है जो कि डिस्क्राइब करता है कि क्या बिहेवियर अप्रोप्रिएट है थेरेपिस्ट के लिए। ये जो एथिकल कोड्स होते हैं ये सब्सटेंशियल एग्रीमेंट में होते हैं विद द एक्शंस दैट कॉन्स्टिट्यूट एथिकल एंड अनएथिकल बिहेवियर ऑन द पार्ट ऑफ द थेरेपिस्ट। एथिक्स का मतलब होता है कि मोरल प्रिंसिपल्स जो कि कंट्रोल करते हैं या फिर इन्फ्लुएंस करते हैं एक इंसान के बिहेवियर को। ये एक फिलोसफिकल डिसिप्लिन होता है जो कि कंसर्न होता है ह्यूमन कंडक्ट और मोरल डिसीजन मेकिंग के साथ। Ethics code provide करता है common set of principles and standards upon which counselors build their professional and scientific work. काउंसलर्स हर बाकी सारे प्रोफेशनल्स की तरह उनके कुछ एथिकल रिस्पॉन्सिबिलिटीज और ऑब्लिगेशंस होते हैं। Moving on, ethical principles are required by counselors. Why? For counselors, encouragement of client growth, then professional responsibility, professional relationships, rights, building trust and boundary setting between client and the counselor. Then Kitchener 1984 identified five moral principles that we viewed as the cornerstone of our ethical guidelines. Ethical guidelines cannot address all situations that a counselor is forced to confront. Reviewing these ethical principles, which are at the foundation of the guidelines, often helps to clarify the issues involved in a given situation. The five principles: autonomy, justice, beneficence, non-maleficence, and fidelity are each absolute truth in and of themselves. By exploring the dilemma in regard to these principles, one may come to a better understanding of the conflicting issues. तो पहले ऑटोनॉमी की बात करते हैं। Autonomy is the principle that addresses the concept of independence. The essence of this principle is allowing an individual the freedom of choice and action. It addresses the responsibility of the counselor to encourage clients when appropriate to make their own decisions and act on their own values. There are two important considerations in encouraging clients to be autonomous. First is helping the client to understand how their decisions and their values may or may not be received within the context of the society in which they live and how they may impinge on the rights of others. Second consideration is related to clients' ability to make sound and rational decisions. Persons not capable of making competent choices, like children or some individuals with mental handicap, should not be allowed to act on decisions that could harm themselves or others. So autonomy basically addresses independence. तो ये प्रिंसिपल जो होता है, इट सेज कि इंडिविजुअल के पास चॉइस होनी चाहिए, फ्रीडम ऑफ चॉइस होनी चाहिए और एक्शन होनी चाहिए। लाइक इट एड्रेसेस काउंसलर की रिस्पॉन्सिबिलिटी कि वो क्लाइंट को एनकरेज करें कि वो अपने डिसीजंस खुद लें। तो दो इम्पोर्टेंट कंसिडरेशंस होती हैं इसमें कि पहले क्लाइंट को समझाना कि उनके डिसीजंस कैसे सोसाइटी में रिसीव किए जाएंगे या फिर वो कैसे इम्पैक्ट कर सकते हैं दूसरों को। और दूसरा कंसिडरेशन ये है कि क्लाइंट की पास क्लाइंट शुड बी लाइक एबल टू मेक साउंड एंड रैशनल डिसीजंस। जैसे कि बच्चे या फिर कुछ लोग जिनको कुछ मेंटल हैंडीकैप होता है वो नहीं बना सकते कॉम्पिटेंट चॉइसेस, उनको डिसीजंस नहीं लिए देने जा सकते जो कि दूसरों को हार्म करेंगे या खुद को। Then second is non-malfeasance, which is like concept of not causing harm to others, जिसको हम यूजुअली बोलते हैं above all do no harm। ये प्रिंसिपल रिफ्लेक्ट करता है आइडिया ऑफ नॉट inflicting intentional harm and not engaging in actions that risk harming others। ठीक है, तो ये बेसिकली बोल रहे हैं कि इंटेंशनली हार्म नहीं करना है किसी भी क्लाइंट को और ना ही ऐसे एक्शंस में एंगेज करना है जिससे दूसरों को हार्म हो। Then third one is beneficence, which reflects the counselor's responsibility to contribute to the welfare of the client. Simply stated, it means to do good, to be proactive, and also to prevent harm when possible. Fourth one is justice. It does not mean treating all individuals the same. Kitchener point out that the formal meaning of justice is treating equals equally and unequals unequally, but in proportion to their relevant differences. If an individual is to be treated differently, the counselor needs to be able to offer a rationale that explains the necessity and appropriateness of treating this individual differently. Then fidelity, it involves the notions of loyalty, faithfulness, and honoring commitments. Client must be able to trust the counselor and have faith in the therapeutic relationship if growth is to occur. Therefore, counselor must take care not to threaten the therapeutic relationship, nor to leave obligations unfulfilled. तो पांच प्रिंसिपल क्या थे? ऑटोनॉमी, नॉन मैल्फीसेंस, बेनिफिसेंस, जस्टिस, फिdelity। Then RCI's Code of Ethics. RCI stands for Rehabilitation Council of India. तो इसका कोड ऑफ एथिक्स क्या बोलता है कि जो भी मेंबर्स हैं या रजिस्ट्रेंट्स हैं, दे शुड हैव पहला क्या, ऑब्लिगेशंस टू द पब्लिक। उनकी कुछ ऑब्लिगेशन होती है पब्लिक को लेके, तो उसमें क्या क्या आता है कि दे शुड एंगेज ओनली इन एक्यूरेट, अप्रोप्रिएट एंड ट्रूथफुल प्रमोशन ऑफ हिज और हर प्रैक्टिस। लाइक जो भी उन्होंने डिग्री या फिर सर्टिफिकेट एक्वायर किए हैं, वही वो उन्हीं प्रैक्टिसेस में वो उन्हीं चीजों का वो प्रमोशन करें। बी रिस्पेक्टफुल ऑफ द राइट्स ऑफ अदर्स इन ऑब्टेनिंग प्रोफेशनल वर्क और एम्प्लॉयमेंट। Then make only accurate, truthful, and appropriate statements or claims about his or her professional qualifications, experiences, or performance. Then obligations to the client. Uh, they shall preserve the confidence of his or her client or employer and serve each in professional and competent manner. Then shall exercise unprejudiced and unbiased judgment and conduct when performing all professional services, and shall practice only his or her area of competence. They should also decline any activity or employment, avoid any significant financial or other interest, and decline any contribution if it would reasonably appears that such activity could compromise his or her professional judgment or conduct, or prevent him or her from serving the best interest of his or her client or employer without making full disclosure to the client and obtaining the client's consent thereto. Shall neither offer nor make any payment or gift to any public official, private client, or industry representative with the intent of influencing that person's judgment or decision in connection with an existing or prospective project in which the member or registrant is interested, and may contribute his service or anything of value to those endeavors which the members deems worthy. Further, a member or registrant has the right to participate in the political process and to contribute time and money to political campaigns. Then last is the obligation to the profession and building industry. Recognize the value and contributions of others engaged in the design and construction process and refrain from making false statements about the work of others and shall not maliciously injure or attempt to injure the prospects, practice, or employment position of others. And encourage professional education and research as well as the development and dissemination of information relating to the design and construction of roofing, waterproofing, and building envelope systems. Confidentiality as an ethical code. Confidentiality is an ethical concept which states that whatever is said between two persons will remain secret and will not be shared without consent. Information is kept confidential unless disclosure is required to prevent clear and imminent danger to the client and others when legal requirements demand that confidential information be revealed. Counselors are advised to explain the limits of confidentiality to clients so that they do not feel betrayed if confidentiality is broken. Then the obligation of confidentiality is relative rather than absolute, since there are conditions that can alter it. Confidentiality depends on the nature of the material, so that the material which is already public or can easily become so is not bound by confidentiality in the same way as the entrusted secret. Material that is harmless does not bind the counselor to confidentiality. The material that is necessary for a counselor or an agency to function effectively is often released from the bounds of confidentiality. Confidentiality is always conditioned by the intrinsic right of the counselee to his integrity and reputation to the secret and to resist aggression. Such rights can be protected by the counselor even against the law. Confidentiality is limited to also by the rights of the counselor to preserve his reputation, his own reputation and integrity, to resist harm or aggression, and to preserve privileged communication. Confidentiality is determined and limited by the rights of an innocent third party and by the rights of the community. The law places physical safety above considerations of confidentiality for the right of privacy. The client is a danger to self and others. A court orders a release of information. The responsibility under the law for the counselor to maintain confidentiality is overridden when the court determines that the information is needed to serve the cause of justice. The counselor is receiving systematic clinical supervision. The client gives the right of confidentiality when it is known that session material will be used during supervision. Clerical assistant process information and papers related to the client. The client should be informed that the office person will have access to the records for routine matters such as billing and record keeping. Legal and clinical consultations are needed. The client should be informed ethical rights of the counselor to obtain other professional opinions about progress and the name of those used as consultant. A third party is present in the room. Clients are aware of person other than the counselor is present and therefore waive their right of privacy in permitting the third person to be present. Clients are below the age of 18. Parents or guardians have the legal rights to communication between the minor and counselor. In intra-agency or institutional sharing of information as part of treatment process, otherwise confidential material may be shared among professional staff when it is in the interest of the client to do so. However, the client must be aware that this is being done. Sharing of information is required within a penal system. Uh, Information obtained from prisoners that may otherwise be considered confidential may be shared within the system in the interest of the operation of the system and disposition of the case. The client's purpose in disclosing information was to seek advice in the furtherance of crime and fraud. The obligation here changes from one of maintaining confidentiality to one of preventing society from further criminal activity. The counselor has reason to suspect child abuse. All states now legally require the reporting of suspected abuse. In order to have best ethical practice, Barnett has discussed three important strategies for best ethical practice, which include a combination of positive ethics, risk management, and defensive practice. तो positive ethics की बात करते हैं पहले. Uh, Positive ethics focuses the psychotherapist on constantly striving to achieve the highest ethical standards in the profession. It is guided by a series of aspirational virtues, which include doing good and providing maximum benefit to the client, known as beneficence, avoiding exploitation and harm of clients and those associated with them, known as non-malfeasance, being faithful to the explicit and implicit obligations that a therapist has to his or her client, which is known as fidelity, promoting client's independence over time and not creating increased dependence on the therapist through the therapist actions, which is known as autonomy, providing fair and equal treatment and access to treatment to all individuals, which is known as justice, and providing adequate attention to our own physical and psychological wellness, that we are effectively able to implement the above virtues, which comes under self-care. Then risk management, although has the same goals as positive ethics for the clients, but it more specifically focuses on minimizing risk for the psychotherapist that may result in ethics complaints or malpractice claims, and it addresses the issues of informed consent, effective documentation, and consultation. Defensive practice focuses on the direct protection of the psychotherapist. It involves making decisions based on reducing the possibility of adverse outcomes for the psychotherapist. Then, talking about competence of therapist, competence is defined as possession of required skill, knowledge, qualification, or capacity. It is very important that therapists are aware of their competence with regard to the level of his or her knowledge, training, and supervised experience in a particular kind of therapy. In addition to the above, some of the authors also include emotional competence to knowledge and technical skills. It is important that the therapist refrain from initiating or continuing a therapy when they know or should know that there is a substantial likelihood that their personal problems will prevent them from performing their work in a competent manner. Responsibilities to the client. Therapy should be undertaken only with professional intent and not casually and or in extra professional relationships. Contracts involving the client should be realistic and clear. Therapists take all reasonable steps to avoid harm to their clients as a result of the therapy. Therapists should seek supervision or refer the client in situations which are beyond their competence. Therapists should promote client autonomy and encourage clients to make responsible decisions on their own behalf. Therapists should maintain professional boundaries. Therapists should avoid any other relationship with their clients which can be detrimental to the therapeutic process. Therapists should maintain confidentiality. This applies to all verbal, written, recorded, or computer stored material pertaining to the therapeutic context. In exceptional circumstances, when confidentiality has to be broken, attempts must be made to seek client's permission. Agreements about confidentiality continue after the client's death unless there are overriding legal considerations. Therapists should not exploit clients in financial, sexual, emotional, or any other way. Sexual relation between client and therapist are never acceptable. This includes any form of physical contact, whether initiated by the client or the therapist. Therapists should not accept or offer payments for referral or engage in any financial transactions apart from negotiating the ordinary fee charged for the therapy. If a therapist makes an attempt to make a relationship with a former client, he should seek supervision. When a client is incapable of giving informed consent, the therapist should obtain consent from a legally authorized person. Any publicity material and all written and oral information should accurately reflect the nature of the service offered and the training, qualifications, and relevant experience of the therapist. Now, talking about the responsibilities to self as a therapist, it is the responsibility of the therapist to maintain their own effectiveness, resilience, and ability to help clients. They monitor their own personal functioning and seek help or refrain from therapy when their personal resources are sufficiently depleted to require this. Therapists should not undertake therapy when their functioning is significantly impaired by personal or emotional difficulties, illness, alcohol, drugs, or any other cause. Therapists should have regular, suitable supervision and use such supervision to develop counseling skills, monitor performance, and provide accountability for practice. Talking about informed consent to therapy is invaluable as it ensures that a patient's decision to take part in psychotherapy is informed, voluntary, and rational. Although it is presumed that seeking help of the therapist for their problems by the patient means implied consent, but this does not amount to informed consent. Informed consent should be seen as the primary means of protecting the self-determination and self-governing rights of clients as it gives the client an opportunity to make an informed decision about engaging in psychotherapy, and it communicates respect for personhood and reflects the collaborative nature of psychotherapy. Therapeutic contract, it is a written document which includes responsibilities of therapists and clients in participating in a particular psychotherapy. It should cover the following: time, the time of the day when the therapy is to be conducted, and provision of change in exigencies. Then duration, the contract must include the duration of each session, which might be 50 minutes, 60 minutes. Then frequency of sessions will be dash per week. It is decided upon it is a mutual discussion between client and therapist. It is decided after that. Then what happens if someone is late to the session? If therapist will be ever late, he will try to let the client know in advance, even if the delay is just a few minutes. If the therapist is responsible for delay in the start of the session and the client can stay longer, then the therapist will see the client you for the full time. If the client arrives late for an appointment, then the session may still end at the scheduled time. However, if it is possible, then the session may go to the full time. If either the therapist or the client is late by more than 15 minutes and don't inform the other party, then the session will stand cancelled. However, in such a situation, either of the party has to bear the financial liability. Then cancellation, in the event that either the client or therapist are unable to keep the appointment, they are required to provide 24 hours notice of cancellation or they will be charged for the session. Then fees, client should make the payment to be made at the beginning of the session. If the duration of the session extends beyond 1 hour, then the patient will be required to pay an additional fee. Emergency contact, if the patient needs to contact the therapist between sessions, she or he should call at the given number and leave the message and also mention that it is an emergency. If the therapist doesn't call back the client in considerate amount of time, say 30 minutes, patient should attend the emergency outpatient department of the hospital. Issues of confidentiality. The therapeutic contract should mention that the therapist will maintain confidentiality of the information revealed during psychotherapy. Termination: if the client decides to discontinue the therapy, he will make this known to the therapist within a session so that an end date can be decided and the client and therapist can work towards an appropriate ending. Then self-disclosure, the therapy will focus on the issues of the client and the therapist will not respond to any questions regarding the personal details, and any such attempt by the client will be interpreted. And last one is homework assignments. As part of the therapy, client will be given some homework assignments in between the sessions and the client is expected to carry out the same. If the client comes to the session without completion of the homework assignment, then the therapist has the right to cancel the session. So that was it. This is all about ethics which are used in counseling or psychotherapy. These are certain things which we should remember as like ethical guidelines. So that was it. If you have any doubt, please do ask in the comment section. And if you like this video, please don't forget to give it a big thumbs up. And please do show your support by subscribing to my channel. Thank you so much for watching the video.